During what is usually a busy travel season, the threat of COVID-19 has made Canada's airports eerily quiet. Heather Jeremiah is heading to Edmonton to visit family. Keeping masks on her 3 kids has been tough, but she says otherwise, flying has felt safe.
None of us are high risk, none of us have underlying conditions, and, I feel pretty okay.
In an interview with CBC last month, Canada's Transport Minister said there is no evidence, there is not a case yet of somebody actually picking up the virus on board the aircraft. But since the pandemic began, scientists have identified several possible cases of in-flight transmission. One happened on a late January flight between Singapore and China. The person had been sitting near 4 infected passengers for an hour and didn't use his mask properly. A second single case was traced back to a flight between the Central African Republic and Paris in late February, while 2 others were believed to have been acquired aboard an early March flight between Tel Aviv and Frankfurt. All cases occurred before masks were mandatory on planes.
If I needed to fly, if I had an ill close relative somewhere across the country, then I would probably not hesitate.
Dr. Alison McGeer says the risk of transmission during air travel increases if passengers are coming from endemic areas. But on board, air filtration systems and masks reduce the risk. It's why the airline industry is pushing Ottawa to consider loosening its position on non-essential travel.
We are operating at about 15% of the traditional year-over-year capacity for this time of year. We cannot sustain this for an indefinite period of time.
Still, if travelers are carrying on COVID, no amount of on-board precautions will eliminate the risk of transmission during the flight and after those passengers land. Heather, Yourex-West, Global News, Calgary.